is a case of Enbloc resection of bladder tumor. I was doing with thulium fiber laser with 1 joule and 10 heads. Now I have used in this case 160 watts laser from Potent company. Though I have not used 160 watt, I am sharing the difference and how I have done in this first case with holmium laser 160 watt. Basically, 60 years old female patient, hematuria 1 month, CT mild enhancing soft tissue, attenuating mass noted along right lateral wall. Multiple lesions were there with carpet lesions. First, we identified the ureteric orifices in a bladder, and nearer to the ureteric orifice, lateral wall, where obstetric jerk can occur, large 3 cm was there. These laser settings and thulium fiber laser difference is the charring is less. In thulium fiber, you have to move fast, then it will nicely cut. Here, if you don't move fast also, it will lift nicely. Distended bladder is essential. You can clearly appreciate the separation from all the sides. These are very useful on the dome as well as the lateral wall, and you can appreciate here the muscle fibers are not getting charred. This is the one difference. In the histopathology, how much it matter we don't know, but without lifting with instrument you can appreciate how white the tissue is, and it is getting separated by itself. Now another tumor was there close to the ureteric orifice. Marking is very easy. Marking usually looks white and you need not move fast. That is the only difference. Otherwise, all these days I have been enjoying doing with TFL, and I have seen in the report that majority of the times we get the muzzle. Almost 95% we are getting the muzzle, so that relook TURBT is not required. Same concept, because I have purchased a new laser, I just analyzing what is the difference. Here there are no conflicts of interest. So many laser missions are coming. Everybody has to share their experience. Now this is a large patch. I thought, how can I remove a large patch without affecting the histology? It constricts, but nicely it lifted off. Now this is a small tumor. I thought, how I will do. I encircled and removed the base of the tumor. See, you can see definitely it is not invasive, and within 1 minute it is. Now this is the ureteric orifice. Around this is the coagulation. A very good feature is this coagulation, which we feel that deficient in holmium, but this coagulation with 25 1.2 is very good. All carpet lesions around the ureteric orifice are coagulated without any orifice changes. Continuously I was observing the orifice, but changes have not come. Overall, this patient post-op did not have any bleeding. It was a large surface area, very big surface, and see the color at the end of the coagulation. No obturator jerk, no logic in getting obturator jerk, because it's a heat produced locally, not current. This is a ureteric orifice at the end, all around coagulated, not stented. And as these fragments have sent, I already got the report. Muzzle is seen, lamina propria is seen, superficial tumor, low grade. So I don't want to go for relook TURBT in this patient for any reason, and I will manage conservatively with recystoscopy and follow up carefully. And mitomycin injection is also given. Even though it appeared like perforation, it is not perforation, because these lasers have a controlled cutting of the bladder tumor. Already we have done many cases. This is the laser inauguration we have done. Again, this mission, how it works is not the one. The whatever first case I have experienced, I am sharing. That is all. Thank you.